Today, this module will talk about the subxiphoid view, but really with the take-home point that the subxiphoid view is really an ideal view that should be thought of when we're intubating a difficult patient. We're not able to have access to the chest, or the chest windows, meaning the parasternal and apical windows, are difficult to find in the patient. Perhaps they have very large lung fields, or patient positioning is preventing us from being able to place our probe in those locations. The utility of subxiphoid view really plays out in these settings because, again, the subxiphoid view is void of the lung fields more than the other examinations, except when there's a pneumothorax, and we'll talk about that. And additionally, the subxiphoid view it can be very powerful when you're in the ACLS situation where chest compressions are being under play, and you would not be able to have access to the chest in that mannerism. So let's talk about it. Under the idea of first, how would you potentially optimize a bad cardiac ultrasound image? One, make sure that you have the best window possible. Very important that when it comes to troubleshooting your windows, how you want to manipulate the ultrasound probe is always make sure you go one rib space above, one rib space below the area that you initially got your ultrasound image to see if your image quality improves. Remembering to move in a circular fashion actually will allow you to get more precise localization of your probe and optimization of your probe, because you'll have that motor memory of reference of where you initiated. So rather than picking up the probe and placing it at a new location, moving in a circular fashion, one rib space above and one rib space below, is the appropriate technique to try to optimize your ultrasound window. Patient position, remember that having the patient in their left lateral decubitus position would be ideal, with their arm extended out to increase their rib spaces. Holding ventilation is a powerful technique for the perioperative setting to be able to sort of minimize the impact of the lung fields. Key thing also, always remember you have adequate gel. In patients who have hair on their chest, the need for ultrasound gel even is further increased because of the fact that those airs can entrain little pockets of air, and so you need to make sure you have a good amount of gel between your ultrasound probe and the skin, and of course practicing more exams. Just to review, tilt and angle, very important to be familiar with the motions. Tilt, if my fingers here are the ultrasound plane, moving along the ultrasound plane is tilt, moving opposite to the ultrasound plane is angle. Just to hear on the assessment of how to improve the image here. So we see that we have part of our cardiac structures not in view. So simply by adjusting the tilt, we're able to optimize that to see all the cardiac structures. Because again, tilt along the path of the ultrasound plane. Adjustment of angle, we talked about this in the parasternal views, but very important to realize that, again, if you have a different angle, you will get very different cross-sections of the ventricle. For example, when the parasternal views, or any of the cardiac views, understanding the manipulation of the angle of how that's going to grossly change the ultrasound plane that you're intubating across the heart, and having an appreciation for that is key. So now let's go with the subxiphoid view and window. So probe placement is, the probe is actually placed in the similar position as you would for the IVC examination. However, now our ultrasound plane is with the indicator at the 3 o'clock position, because we want our ultrasound plane to get a cross-section of the left ventricle. So essentially, compared to the IVC where the indicator was open, it was aiming at the 12 o'clock position, we're now aiming at the 3 o'clock position to get that more transverse cross-section of the cardiac structures. Very important to realize you need to identify one subxiphoid space, and we'll highlight this again when we come to the simulator demonstration. Flexion of the hips and knees can help by decreasing the pressure so that it's less stimulating to the patient. Again, 90-degree rotation from the IVC view. And the key thing about this is that making changes in the probe position by adjusting the rotation and the angle of the ultrasound probe, you're actually able to get very similar 2D images as you would get from the apical and parasternal windows. And I encourage you to practice using the ultrasound probe in this subxiphoid space and learning how you can manipulate by changing the rotation and the angle to get 2D images that look very similar to the apical and parasternal views. Very important to also realize that if you're not able to, if you see the liver and then you have complete dropout beyond that, the potential of pneumothorax does exist, and I encourage you to evaluate using the pulmonary point-of-care ultrasound exam techniques we've discussed to evaluate for the possibility of that. So for subxiphoid view, number one, place your probe in the subxiphoid space and then identify the liver, because we're going to use the liver to be the acoustic window into the cardiac structures. So after you place the probe in the subxiphoid view, you want to adjust in the subxiphoid space, you want to adjust your probe such that the liver is in the majority of your screen. You can see here we have bowel on this side of the ultrasound image, and so simply by moving the ultrasound probe to the patient's right, we'll be able to get more of the cardiac structures because again we're using the majority of the acoustic window of the liver to insonate the heart. Having the patient also take a deep breath in by flattening the diaphragm and allow all cardiac structures to get closer to the probe, and that also can improve your image quality. And I mentioned this, but it's one of those things you'd have to practice with the hands-on session. Learning how to rotate the ultrasound probe in this position can give you images that can be very useful. So this picture here shows something very similar to a parasternal short-axis view. And this is actually obtained from the subxiphoid space. Simply by rotating the probe counterclockwise, we're able to get very similar to a parasternal short-axis like view. And again, for the hands-on section, it's really important for you to practice this manipulation. Similarly, you can adjust your tilt and get, this is more traditional view, but we've adjusted our tilt to be able to shine across the various cardiac valves. And by doing that, we're able to actually potentially use color Doppler. Remember, we're not completely parallel to flow, but we are definitely more parallel in this view than we were in the parasternal. So it is when your apical view is not an option, you can get a apical-like view from the subxiphoid space. Okay, so hopefully the key take-home point with the subxiphoid space is identifying the liver to insonate the heart, and then once you have the heart in your ultrasound screen image, you want to adjust your tilt, rotation, and angle to get different cross-sections of the cardiac structures to produce images that can be very similar to the parasternal and apical windows. So now we're going to talk about the subxiphoid window. The subxiphoid window is an important window to evaluate cardiac structures, especially because of the fact that sometimes we are not able to have access to the chest and insonate the heart from the chest windows we discussed, or the parasternal and apical window. And the subxiphoid window allows us to be able to still see images of the heart without having to shine directly over the cardiac silhouette. The key thing to remember about the subxiphoid window is because of the fact that we are insonating a little bit further, the picture quality will be a little bit more poor compared to the parasternal and apical windows. But you'll find as we do the examination that often this window can be ideal in the situation where we're not able to get to the chest, or the patient's position prevents optimization of those parasternal or apical windows. The subxiphoid window, in fact, is much less patient position dependent. The supine position can give you an excellent window into the heart. Key things to remember is the identification of the subxiphoid space. Often people, when they first look to identify the subxiphoid space, they end up identifying it much more distal than where the true space is, meaning it's identifying it as closer to the umbilicus. Truly feeling for the subxiphoid space is key. So identifying that, and then making sure that you have the ability of decreasing the tension in the abdomen by allowing the patient to flex their knees will allow you to apply pressure in that subxiphoid space without causing too much patient stimulation. So to attain the subxiphoid window of insonating the heart, what we're going to do is place our probe in the now identified subxiphoid space with the indicator at the 3 o'clock position, such that our ultrasound plane is shining up to the heart in this fashion. So we're starting with our indicator at the 3 o'clock position. We're placing the probe in the subxiphoid space, and our first step is to identify the liver. The reason why we want to make sure we identify the liver is because we need our ultrasound window to insonate through the liver to be able to see the cardiac structures appropriately. Let me show you by sliding over here If we have bowel, you'll not be able to see cardiac structures because the air in the bowel will prevent insonation up into the cardiac silhouette. And so therefore, first step when you're trying to identify cardiac structures from the subxiphoid window is to make sure that you're insonating through the liver. And that's what we see here at the top of our screen. Notice also how I'm holding the ultrasound probe. The ultrasound probe, unlike the other cardiac views where we are holding it like a pencil and resting our wrist on the patient, because of the fact that our angle has to be fairly superficial with the skin, we wouldn't be able to hold our probe in this fashion. In fact, rather we take our hand and place it on the top of the ultrasound probe. That allows us to be able to lower our angle to get the appropriate angle of insonation to see the entire cardiac structures. So now we've gone through that, we've identified the liver, we're now identifying our cardiac structures. We see the right atrium and right ventricle in this picture. I'm adjusting our tilt to be able to see more of the apex of the RV and LV. And notice how we're able to see various valves by simply adjusting the angle of our ultrasound probe. So by a little bit higher away from the skin, we're able to see the tricuspid and mitral valve nicely. By lowering our angle, we're now seeing the aortic valve. And by simply adjusting our tilt, we can identify these valves to be more parallel to flow. And so the utility of using color Doppler does exist in the subxiphoid window to evaluate for crude valve function. Notice we are not completely as parallel as we were in the apical window, but in that situation where the apical window is not available to us, this can give us a crude assessment of overall valve function. And again, simply we're just adjusting our angle with the skin to see the various cardiac valvular structures. Now to another area I'd like to highlight is we're going to adjust our tilt to have the left ventricle more in its entirety through our structure in our ultrasound window, and we're going to rotate counterclockwise from the 3 o'clock position shown here to roughly around the 1 or 2 o'clock position. By doing that, we're able to get actually a short axis cross section of the left ventricle. And so you can see that a very similar view as we got from the parasternal short axis view can be obtained from the subxiphoid space by simply just rotating our probe counterclockwise to roughly the 1 or 2 o'clock position. So here hopefully I've been able to show that the subxiphoid window can be a very useful window to evaluate the heart and get similar images as you would get from the apical and parasternal views simply by adjusting the rotation and the angle with the skin in the subxiphoid space.